Assalamu alaikum. Dear viewers, welcome to our program, Hello Doctor. You know that as usual we discuss on this program various health topics. Today also we will do same thing, but today we will do in different way. Today we will give you some information and we will discuss very important things. So hopefully you will enjoy this program. Today we will discuss about NHS Patient Access Campaign. The NHS latest campaign aims to help people understand which NHS services to use when they need medical help. So today we have Dr. Ebadur Choudhury, is a GP and GP trainer based in Portsmouth, Hampshire. With over 10 years of experience, he trained in the northeast of England and is dedicated to patient care. Is here to tell us more about this important campaign and why it matters for our community. So viewers, let's invite our guest, Dr. Ebadur Choudhury. Assalamu alaikum.
Wa alaikum assalam. Hello viewers, assalamu alaikum.
Thank you to accept our invitation. Can you hear me, sir?
Yes, I can hear you.
So we are grateful to you because you are here to help us and giving information to our viewers.
Thank you.
Before I start the program, I want to know something about you, something about your job and about your job places. If you tell us very shortly, sir.
Actually, I'm a GP and GP trainer based in Hampshire, working as a GP about more than 10 years. I trained in northeast of England. So I work with NHS England, also MMC, which is part of NHS England, to raise the awareness amongst the minority, or if you say the term like ethnic minority people like South Asian, also Afro-Caribbean, and all others, minority people.
Thank you so much. So let's start our program is about NHS Patient Access Campaign. So my first question is, what are the key NHS services that we are talking about as part of this campaign?
As part of this campaign, we are mostly talking to people about NHS 111 and the services that your local pharmacy offers, as well as using the NHS app to access support from these services.
Okay, so this is NHS 111. So next, I want to know
how to access to the local pharmacy.
Yeah.
Also, how to use the NHS app to get support for the access.
Okay, so this is all about to help our patient who want to join to the NHS campaign or like NHS doctor like this.
Yeah, this is like for day-to-day, like for patient access. Actually, lots of people don't know how to access the system. If they can't get through to a GP, they find it's difficult to where to go, where to seek help. That's the reason we are doing this campaign, to make patient or make people aware about the other services.
Okay. So next one is, why are these services helpful for the community?
We know that during our day-to-day lives, it can go too busy. We don't always put our health first. In fact, a recent NHS survey found that 6 in 10, that means 60% South Asians, said their busy lifestyle makes it challenging to manage their health and stay healthy. More than a third, about 36% of South Asians also said that not having enough time to make an appointment would stop them from seeking urgent medical help or advice for a health concern. It's really important that people are able to take charge of their health and their time so they can feel at their best and spend more time doing the things they love. So when life gets busy, there are easy way to get help you need through NHS services.
Yes, life is very busy indeed.
That's true,
What,
yeah.
what exactly is NHS 111 and why should people use this service?
So NHS 111 can help you if you needed urgent medical help, but you are not sure where to go. You will be assessed and directed to the right place for you. Contacting NHS 111 make it easier for you to get the right advice or treatment. It is available 24 hours a day, 7 days a week. When you contact NHS 111, you will be asked a series of questions about your symptoms. When you contact NHS 111, you will be asked a series of questions about your symptom. You can answer the question yourself or on behalf of someone else. Depending on what you need, you might be advised for or advised to. They may advise you to go to attend A&E or be transferred to 999 in an emergency, go to an urgent treatment center, contact your own GP surgery, see an evening and weekend GP clinic in local areas, sometimes they call GP out of our service, get a call back from a nurse, a doctor or paramedics, get urgent specialist support for dental or mental health problems, see a pharmacist for help with a minor illness, look after yourself safely at home. To ease the service, people can go online at 111.nhs.uk, use the NHS app or call 111.
Thank you.
So there is 3 ways you
Yeah.
can contact online. 111.nhs.uk.
Phone call.
Then is the NHS app,
App, yeah.
and you call 111.
Yes, thank you. So you know that Britain is a multicultural people live here. So if there's someone who wants to use 111, but they don't speak in English, so is there anything they can do?
Yes, absolutely. If they need help in another language, they can call 111 and ask for an interpreter, which means that people using the service from our communities can still get urgent medical advice, even they don't speak English. On top of that, British Sign Language is also offered through the services. So the deaf community can also get health advice from 111.
This is great. So, and what sort of things can our local community or local pharmacist help with?
Local pharmacies, known as a community pharmacist, can provide some prescription medication if needed for 7 common conditions without you seeing a GP or needing to make an appointment. So they can provide a really useful service where you can just go there and see someone for a particular health issue. They can help especially with earache in those between 1 and 17 years old, impetigo in those aged 1 year and over, insect bite in those aged 1 year and over, shingles in those aged 18 years and over, sinusitis in those aged 12 years and over, sore throat in age 5 years and over, uncomplicated urinary tract infection or UTIs in women aged 16 to 64. Pharmacists can also provide oral contraception. So don't wait for minor health concern to get worse. Go and get seen by your local pharmacy team.
So, our pharmacists are qualified to give clinical advice.
Of course, pharmacists are more than qualified to treat this minor health condition. Every pharmacist trains for 5 years in the use of medicine, which involves 4 years in university, then a placement year working in pharmacies within the community. As part of their clinical training, pharmacists are taught how to manage minor illness, provide general health and well-being advice to help people stay well. They also work with pharmacy technician and pharmacy teams. These are registered health professionals and are subject to the same qualification as pharmacists.
So how can I find a pharmacy in my local area access NHS 111?
To find a pharmacy in local area, you can visit nhs.uk/think pharmacy first.
Yeah.
Other you can go to you can search on Google like a pharmacy near me. You put your postcode and it will show the all available NHS. Pharmacy.
Pharmacy. Okay. So dear viewers, so please remember nhs.uk/think pharmacy first. This is the main key point. Can I just walk into a pharmacy and get advice?
Yes, absolutely. And you don't need an appointment. It is convenient way to get advice. You can simply walk into your local pharmacy and speak to the pharmacist. And you can also be seen in private consultation room.
So what can I use the NHS app for?
You can use the NHS app for many different things. For example, you can order your repeat prescription to pick up at your local pharmacy without having to arrange a trip to see your GP. You can also use the app to access NHS 111 online and telephone service, depending on which you would like to use. Millions of people already using NHS app, and you can download it on your smartphone or tablet. You can find out more at www.nhs.uk/NHS app.
Thank you, sir. So lastly, any final words of advice to your listeners or our viewers?
Using the right NHS service for your needs is easier than you may think. If you have a medical concern, the NHS is there for help you. So I would say if you are not sure what to do or where to go, just call 111 service or go to your NHS app and seek for, find a useful link or, for your medical concern.
Thank you so much, sir. Thank you for your advice and thank you for your information. I think it is great for this program. Thank you so much.
No problem. Thanks for your time.
Thank you.
We'll see you again sometime soon.
Inshallah, of course. Dear viewers, using the right NHS service for your needs is easier than you may think. You will get appropriate and reliable help wherever you use. Thank you so much, viewers.